Hello and welcome back, everybody. I am now here with Dr. Michael Braitsch. He is a licensed doctor of physical therapy, a former amateur fighter, former kinesiology professor, and an internationally certified fight referee. In addition to treating individual patients, Mike runs group exercise programs steeped in leading evidence from physical therapy and exercise science to help people with chronic and progressive conditions move and feel better. Thank you so much for being here.
Hey, thanks for having me. I'm glad to be here. Glad to see you all. Hopefully you can see my screen. And I'm so excited to talk with you about this stuff. So coming to you live from cloudy Dallas, Texas, I first want to say, because this was intended for folks in Baton Rouge, and I am a lifelong Cincinnati Bengals fan, sadly enough, and have learned a lot about resilience from being a Bengals fan. Thank you, LSU friends, for Joe Burrow. We are so excited about that. Anyway, let's talk about what we came here to talk about, which is using exercise to manage Parkinson's symptoms. And I've got some slides, but here's the big takeaway. The best kind of exercise is the one you will do both consistently and also safely. So there's a tricky two-part equation. Not just consistently, but also, since I'm a PT and I care about your health and safety, I want to make sure you're doing it safely. I've got, like so many other people, disclosures, and the big takeaway is this. We're going to go through, there's so many programs out there for people with Parkinson's, which is fantastic. And I'm not here to tell you one's better than the other, because I think if you'll do it, and if you're getting some relief, that's great. What I'm hopeful you'll get from our time today is some information that you can apply to whatever program you're interested in. So the big thing with these disclosures is saying, I don't know you personally. I wish I did. I wish you could come here to Texas and we could hang out. But obviously, before you begin anything new, especially with intensive exercise, I'm really hopeful you will talk through that with your care team. I'm really hopeful you've got people you can talk through that with, and if you don't, I'm really hopeful you can talk with your doctor or your physical therapist to make sure that you've got really good ideas specific to you. I say that because Parkinson's disease, more than any other diagnosis I've worked with, responds very well to exercise. But also Parkinson's disease tends to hit people a little bit later in life after you've already got some wear and tear on your joints and after you've already got some things going on with your bodies. So what I'm giving you here today are some ideas, and hopefully you'll be able to take those ideas and then take them with you to people who know you to help custom tailor that, custom fit that information for your specific needs. We'll do some activity. And during that activity, again, I don't want to sound like I'm excessively worried, but we just heard Dr. Mapstone say earlier this morning that there can be an increase in risk-taking behavior as one of those non-motor symptoms. I want to make sure during our activity, you're safe and that you practice at your own risk. So that's enough of this stuff. What we're going to talk about over the next 26 or so minutes is current concepts from exercise and how that relates to people with Parkinson's disease and how that can impact people with Parkinson's disease. But before we jump into that too, I want to make sure we go over some ideas for physical therapy. I'm very active in the physical therapy community. I worked hard to get my doctorate in physical therapy. I work hard to maintain my license in physical therapy. You hear my dog sneezing in the background. I'm sorry about that. But I want everybody to know the paradigm is changing in our world for how physical therapy helps people and how physical therapy helps people specific to their needs with Parkinson's disease. And I'm not going to get into all the details of it, but I want you to think about if you haven't enlisted the help of a PT, a physical therapist, a licensed physical therapist, hopefully you will, because it used to be a world where a PT would see a patient with Parkinson's until they either met their goals or until they ran out of visits. And now we're in a whole new world where Medicare caps have been lifted and extended to some degree, and where people can use PT as more of a way to keep control or rein in symptoms associated with chronic and progressive conditions like Parkinson's. I know in my clinic, we use PT as more of a tune-up, and we use group programs as more of a mainstay of care. And we really see exclusively patients with Parkinson's here. But hopefully you can look at that list, and if you see something that you're experiencing, you can know, I could see a PT for that, and that would be helpful. Okay, I put this picture up because it is the commonly used medical textbook photo of what someone supposedly looks like with Parkinson's disease. And you might say, I don't look like that. If you do, we'll go over some options for how you can work on that. If you don't, we're going to go over some options for how you can prevent some of this or slow the worsening of some of this. And the good news too is we've heard so much today about the role of exercise in treating some of these non-motor symptoms. And I think that's such a big deal because we're seeing, when you look at this cartoon image of the stereotypical person with Parkinson's, and then when you think about all the folks you see online through Davis Phinney Foundation events, or you see at some of these Team Davis Phinney racing events, you don't see a lot of people like this. And that's not to say that exercise will guarantee that you don't experience symptoms. That's not to say that exercise will absolutely undo what's been done. But regardless of what stage or progression of symptoms you're in along the spectrum, exercise can help you boost your quality of life and your function, no matter how far you are on that spectrum. And what do I mean by that? I've got some patients who come into my clinic who were just recently diagnosed, and we're getting a bunch of measurements, and we're looking at areas from this exact picture that show what's in store for them in the future. And we're coming up with a plan to slow the worsening of those symptoms, or a plan to come up with modifications or compensations for symptoms they've already got. And that all kind of comes from these current concepts, which the best news is these current concepts are really old ideas. They've been around for a long time. We know that the more you do something, the easier it is to keep doing that. And we know that if you're more active, every other system in your body is going to function better. So we've got a quote up here from Dr. Daniel Korkos where he talks about how not only is it good for the heart, the brain, and the muscles in the same way it is for healthy people, but it modifies signs and symptoms of Parkinson's disease. Or put differently, as my friend Winston would say, when I work out, I feel a lot better the day of the workout and even the day after the workout. When I don't work out, I start to feel my symptoms much more intensely. And so we know that in a perfect world, everybody would exercise. And we know that everybody should exercise. But the good news is there's never been a better time to face this thing called Parkinson's, because we're learning more and more about why exercise helps. We're learning more and more about the role of exercise and specific types. Or if you look behind me, and if you can't see it on your screen, you will in a bit when I turn off my screen sharing, you'll see one of my heroes, Jack LaLanne, on the wall here, the godfather of fitness. And that's Jack LaLanne on his 70th birthday, trying to do the Davis Phinney victory, arms in the air, and instead he's handcuffed because he's showing people you can age well through exercise. He swam across the San Francisco Bay handcuffed, towing rowboats. Now, do I think anybody needs to do that? No, but I think it's a good example that exercise helps, an active lifestyle leads to a healthy lifestyle and a better quality of life, regardless of what's going on. So when you think about improved motor performance, earlier we heard some of our speakers talk about things like bradykinesia, or even bradyphrenia, slowness of movement, slowness of thinking. And what we found is through things like scientific research, like here's a paper from 2013 where I've highlighted a few keys. When you think about levels of evidence, you know, usually expert opinion is like the lowest level. The highest level of evidence would be things like systematic review and meta-analysis, where we're not looking at just somebody's experience, we're not looking just at one study, but we're looking in this paper at 18 different randomized control trials that showed aerobic exercise led to improved motor action, which means you can move more freely and more quickly, as well as improved balance and improved gait, which is the fancy PT term, as many of you know, for walking. So just through doing aerobic exercise, there are immediate beneficial effects for people with Parkinson's. And really, what does all that come back to? That comes back to an old concept with a fancy name. The old concept here is neuroplasticity. Well, that's the fancy name, actually. Sorry, I misspoke. The fancy name is neuroplasticity. The old concept is you practice, you get better. If something is complicated, you break it down into key components. You do those components over and over and over, and it gets easier. And that's how you can make lasting changes in the brain. And the really fancy way for how that works is through a great term called dendritic arborization, meaning dendrites are connections between neurons in the brain. And the more you do something, the more you can strengthen those dendrites, strengthen those pathways in the brain. Earlier, we heard both of our presenters talk about non-motor symptoms and talking about trying to find new ways to learn things that are new, to engage our cognitive function. And exercise is a fantastic way to do that. Probably everybody here on the presentation or on the webinar has heard the old phrase of use it or lose it, which is the fundamental concept of neuroplasticity. But a lot of people would also say use it and improve it. So what we can do is we can strengthen motor patterns in the brain. So a good way to think about that, like Dr. Mapstone mentioned, was comparing Alzheimer's disease to Parkinson's disease. For some reason, there's a lot of confusion when I first speak with people about why would we talk about Alzheimer's? Well, it's both center in the brain. Both diseases take effect in the brain, but both operate very differently. So if you think about Alzheimer's disease, you think about if the brain is a computer and I'm trying to load a program in that computer, maybe nothing loads. Or with Alzheimer's disease, if the brain is a computer and I'm trying to load a program in that computer, perhaps the wrong program loads. That's very different from Parkinson's disease, where if the brain is a computer and I'm trying to load a program in that computer, it's there, it works, it just might load much more slowly. Or my friend Leah once joked with me and said, my brain opens the computer program with maybe 100 different tabs. So it gets hard to figure out where I am or why things are loading so slowly. And that's important to consider in the context of exercise, because if you can strengthen patterns in the brain through doing things over and over, it makes it easier to load those programs when you need them. And also, over time, you can start doing things like dual task or increasing your cognitive load, where when one program gets easier to load, you start adding to it, and that way you can keep improving the strength of those connections and improving overall function of the brain just through exercise. So I've said a lot. I think it's probably time for us to try a little bit. And here's what I'm going to do. I'm going to hit stop share, which I think is working. Good. And hopefully I can get my screen here maximized.
It looks great, Mike.
Oh, good. Okay. So as Mel mentioned earlier, I love martial arts. And I'm very fortunate because I grew up doing martial arts. I also got to compete a lot in amateur fighting. So I tend to fall back on things like boxing and on Tai Chi, both of which have been heavily reported to help people with Parkinson's. Tai Chi is the one with the most research, but let's think about neuroplasticity. And if you're participating at home, I want you to know I'm not with you, unfortunately. So I can't be there to make sure you're safe. So hopefully you can self-monitor for intensity, and hopefully you can make sure you're participating in a safe way. All we need here are a few feet of uncluttered space, no loose carpets or anything like that. And you can do this from a chair, or if your balance is strong and you feel good, you can do it standing. But let's start out with our feet about hips width apart. And if you're standing, why not bring 1 foot back just a little bit and 1 foot forward a little bit? We'll bring our hands up. And so already we're in fighting stance, okay? So we got a little bend in our knees. Hands are up to cheek level because we want to stay pretty. And with the front hand, there's one hand that's a little bit closer to the computer here. I'll call that the front hand. For me, that's the left. And then there's a back hand. For me, that's the right. Let's also make sure none of you punch your computer screens. This could be a very expensive lesson for you if that's the case. But all we need to do is just reach out and pull back. That's our jab. We just reach out and pull back. Reach out, turn the knuckles over, pull back up high, out and back. And we can just start doing that. We know that for Parkinson's disease, it's most affected, when we think about the center of the brain most affected, it's the basal ganglia. The basal ganglia, we know, is responsible, among other things, for starting and stopping big movements. So when we think about exercise and Parkinson's disease, I want you to think about big dynamic movements. So this is our jab, and what a typical Parkinsonian jab would look like is almost like a Bruce Lee situation, a small punch. I want you to really emphasize reaching far out, pulling back, reaching out, pulling back. And you can see how we could tie that to an everyday activity, for example, of reaching out into the cabinet for a coffee cup, right? And we know when we're reaching out, it's not helpful if you're folded forward with rounded shoulders and a bent trunk. So we know already it's important to keep the trunk up, keep the head up, keep the hands up. We're reaching out, so we've got our jab. And we're getting pretty good at that, I would imagine. We could use our backhand here for a cross. The cross is another straight punch where we turn out, reach far out, pull back up high, out and back, out and back, out and back. A good thing about boxing training is we get to work on reactions and timing too. Because if you were with a boxing coach, hopefully one that's been well trained on helping people with Parkinson's, they would call out different numbers. They would call the jab, for the jab they would call 1, and that means jab. For the cross they would call 2, cross. And so they'd tell you things like 1, 2, and you'd throw your jab and cross. 1, 2, jab and cross. 1, 2, jab and cross. We also have other punches like the hook, where you drop your front hand just a little bit, and almost like you're scraping the inside of a barrel, you come around and you can get a nice hip turn with it. So when we think about how can we move and how can we move in a way that helps Parkinson's, just about any type of movement can be helpful. But if you can move in multiple planes, and if you can move in a way that gets your heart rate up, and if you can move in a way where you're forced to think about what you're doing and to have big dynamic movements, that's helpful. So we know, let's think for a second. We know the jab is 1. We know the cross is 2. That hook we were just doing is 3. We won't have to get too crazy from here. So we could say 1 and throw the jab. 1, and then we could say 1, 2. And then we could say 1, 2, 3. So you know we can get in a pattern of calling things out. How about 1, 2, 1? And hopefully that just confused you. That's a good thing, because we know if it challenges you safely, it can help change those patterns that we're strengthening in the brain. So we could say 1, 2, 1, 2, 1, 2, and 3. Or we could say 1 and 3. And even without any equipment, hopefully you're already starting to feel your blood flow improve. Hopefully you're already starting to feel a little bit more awake. And hopefully you're seeing how, wow, if I think about this stuff and I really focus on big dynamic movements, and I focus on keeping my head up and back up, you can see how it would be easy to, over time, build more and more into a workout and to use whatever type of movement to strengthen movement patterns. Another one I love to strengthen with people, I've got this chair here, is squats. Because if you think about it, what's one of the most important things for you to do every day to be able to get on and off a toilet, in and out of the car, on and off a chair. So I love to have folks squat and work on, in PT we call it sit to stand. In workout classes, we squat like crazy. And we've got a saying here at Tribe Wellness, which is every day is leg day, because you don't walk around on your hands, right? So boxing is fun, but also a really good boxer has very good footwork, very strong hips, very strong legs, and a great core. So let's get back to our slides so we can dig a little deeper into this stuff. But hopefully that was a way to wake everybody up a little bit. Here we go. Okay. So what are some concepts of neuroplasticity? Well, you got to experience a bunch of them there. Use it or lose it. Those movements that we use, we strengthen the patterns of. Use it and improve it. Again, strengthening the patterns. Specificity, that's a big deal, because you want to find tasks that are important to you. Tasks that, if you've got a challenge, like with your walking, or if you've got a challenge like with a certain type of movement, if you can take that challenge on under the guidance of a good coach, it's easier and easier to make big improvements. One thing I love about boxing is point number 4, repetition matters. The more repetitions, the easier it is to strengthen those patterns. And intensity matters. There's more and more research coming out on the value of intensity. And moderate to intense aerobic exercise, more so than any other, in improving hormone releases, important nerve factors, and growth factors from the brain and other systems to really slow the progression of symptoms. Time matters too, and for that I'd say time on task is a big deal. And we just heard 150 minutes minimum of exercise each week is a good idea. Some folks that I see aren't quite there yet when they first start, but I think it's good to gradually increase your time on task with your workouts to get somewhere between that 150 minutes, which is the minimum recommendation by a number of different organizations like the Mayo Clinic, the Council on Aging, and even the CDC. I'll say 150 minutes is the minimum, all the way up to 300 minutes being the real goal. Unfortunately, here in America, we tend to focus on the minimum. But really between 150 minutes of exercise a week to 300 minutes a week should be the goal. And the good news is if you're not there yet, don't worry about it, but it's something you can work towards. On here, I've got age matters too, because I know a lot of folks that I see, they get Parkinson disease after they, not in their childhood or in their youth. For concepts of neuroplasticity, we know as we age, it's harder to learn new stuff. If you talk to your kids or your grandkids and they're learning a new language, it's not going to be as easy for you to learn it, but that doesn't mean you can't learn it. So that might mean that while it's harder to learn new stuff as we age, that just means we got to practice more, and that's okay. So slow the progression of symptoms. Moderate to intense aerobic exercise is the single most important factor. And that's because it's linked with slowing the progression through things like improved levels of BDNF, brain-derived neurotropic factor, which are linked with all kinds of different cellular cascades of nerve repair, strengthening nerve pathways. And what's nice about this too, when you look at the bullet point in the middle that says improvements in UPDRS motor, ADLs, that's activities of daily living, and mentation scores, is mentation scores are linked with what was mentioned earlier with executive function. And executive function, how you process information from the world around you, is strongly linked with how good your balance is. So executive function, strongly linked with balance. Intense exercise can really help with that. There are other things for balance training too, don't get me wrong, but it's good to know that if you're pushing yourself a little bit beyond your comfort zone, and not so hard that you feel like you're going to collapse, but just a little bit beyond your self-selected level of intensity, there's so many great things that can occur. So how do you get from the cartoon Parkinson picture to my buddy Steve looking mean as can be, getting ready to take on the world with boxing? Well, through a program that incorporates things like what we've been working on, working in multiple planes, multiple directions, getting good rotation of your trunk, good rotation of your thoracic spine, big dynamic movements instead of smaller automated movements. And that could come from a number of things. If you look at the pie chart on the left of your screen, every exercise program should include a strong component of strength training, because we want to be strong. Our bodies, as we age, naturally lose muscle mass and naturally lose strength. So just like you would save for retirement and you try to build a nest egg to draw down on into retirement, you could do the same thing with strength training to build a functional reserve, so that way over time, despite losing some muscle mass from normal aging and despite losing some strength from normal aging, you still have functional strength for daily life. Not all of us need to be, Arnold Schwarzenegger level strong, but it certainly wouldn't hurt to have more muscle mass and more strength as you head into late stages in life. Because most people don't die from Parkinson disease, and everybody knows that. What do most people die from in the world? They die from heart-related problems. So if you can build strength to have great function in life, that's very helpful. Also, for daily function, it's great to work on balance. And something that I wish everybody did more of was flexibility training. How do you do that? Well, you see in the center too, intensity plays a role for all of that. But there are a number of ways to do this. So when you think about intensity, boxing is great because with very little effort, we just got our heart rates up a little bit. You could do the same thing though with a treadmill or with a rowing machine, or we've got a hiking group where we get a little crazy out here in Texas and we train and we use pole walking, not as an assistive device, but we like to use those poles as a way to get the heart rate up, to promote an upright spine, and also because a lot of people that I see have kind of a a decreased arm swing with one arm as a result of their Parkinson's disease. So pole walking helps with that, hiking with trekking poles. An elliptical machine can help with that. Rowing machines could be good. On here you see I put kickboxing maybe, because I've had people ask me about that, but there's a baseline assumption if you're going to do kickboxing that you have enough balance and control of your balance to kick. If you're not there yet, maybe just start with regular boxing first. And if you don't have the ability to stay standing upright for a long time because of back pain or balance problems, know that you can still modify all this stuff to start out from a chair. This is all very doable. Wherever you are, there's a way to exercise. And we're learning that now as we deal with coronavirus. We're learning that more and more people are streaming exercise programs online. We know that more and more people are finding ways to exercise from home without fancy equipment. There are all kinds of great things you can do. But my hope with intensity here is that you'll be able to look at something like this rating of perceived exertion scale as a way to say, how hard am I working? And my hope is if 0 is like you just woke up from a nap, and if 10 is the hardest you would be able to work, my hope is that you'd get to somewhere between a 4 out of 10 in terms of intensity and maybe up to an 8 out of 10. I find that if people really go all out, if they use what I like to call the CrossFitter mentality, which isn't a bad thing if you're gearing up for a big competition, but if you're training to have a better quality of life, if you overdo it, there's a risk that you can have a short-term spike in symptoms. So you get the same benefit from a 4 or a 5 out of 10 as you do from a 7 or 8 out of 10, according to a fair amount of research that's going on with intensity. I've got some ideas for you for strength and flexibility too. They come down to fighting postural components with Parkinson's. And what does that mean? In general, muscles on the front of the body, just from normal aging, or that get accelerated by Parkinson's, they can tend to tighten down. Muscles on the back of the body can tend to get weak. So if you think about muscle targets, there are a lot of ways to get stronger, but hopefully you can think about strengthening muscles on the back side of your body, in addition to keeping strong legs for a strong life and a good healthy core. I think I'm running out of time here, but hopefully this has given you a few ideas, because let's face it, there's never been a better time to have to face this thing, because we've got so many ways to connect with each other. We've got so many ways to get and stay active. And we know more and more that the worst thing you can do is hide out. The best thing you can do is find a way to consistently and safely be active. And one last thing here before I pipe down and let everyone move on is a great resource for that, if you haven't gotten it yet, comes from the Davis Phinney Foundation. It's called the Every Victory Counts Manual. And I'm sure there's information about it in your program. I'm sure you get emails about it, but it's the single best resource in print for people with Parkinson's. And I try to make sure that everybody I see gets a copy of it, because it's got some great ideas that extend far beyond what we could cover in a 30-minute discussion.